Now we're going to talk about cardiovascular diseases and how stem cells can help you. Umbilical cord stem cells, like I've mentioned before, has the possibility to actually change into multiple cells, and one of the parts of it is changing into cardiovascular related cells. So when it comes to cardiovascular problems, we're talking about heart attacks, we're talking about heart failure, we're talking about high blood pressure, we're talking about high cholesterol levels, we're talking about high triglyceride levels, we're talking about circulatory problems. That means lack of blood flow to your fingers, your toes, you feel numbness, you feel tingling sensation. So all these are related to cardiovascular problems, which is the heart, which is the vessels, which is your cholesterol levels. Now, stem cells has the possibility to do the following. It can repair damaged tissue. For instance, if you have a heart attack, your tissue in the heart would be damaged, and stem cells can actually repair those tissue, meaning giving your heart a second chance, giving your heart the ability to actually function back like how it was functioning before the heart attack. It also has the capability to regulate our blood circulation, which is very important for high blood pressure. So if our blood circulation, the constriction and the dilation of vessels is regulated, therefore the high blood pressure will be more controlled as well. Stem cells can also bring down triglyceride levels in the body. This is due to a property of the umbilical stem cells, which is regulation of our body's metabolic rate. When the metabolism of our body increases, the function of our body or the ability to break down things like triglyceride, high cholesterol levels becomes better as well. So these are a few of the things that can be done with stem cells, umbilical stem cells, when it comes to cardiovascular related problems. Now, my personal experience, I have seen patients with high blood pressure having much more regulated blood pressure. Control is excellent. Some of them have even come out of medication. Better lifestyle, they claim that they are able to push their bodies a little bit more. For instance, they can run further, they can climb, they can do hiking, they can do climbing without having too much of fluctuation in the blood pressure. Also, when the triglyceride levels come down, that puts our body at less risk to develop heart problems, less risk to develop things like diabetes or other metabolic problems, because triglycerides is one of the main contributors for these problems. And what we have seen when we use umbilical stem cells is that triglycerides respond very well, and they tend to drop very quickly without significant changes in your lifestyle. So we're not saying that you have to completely cut everything that you have been eating, but of course we would encourage you, or we would give you certain advices. But stem cells, even without significant changes in your lifestyle, has the ability to bring these levels down. So these are a few, but not all, of the achievements that we have seen using umbilical stem cells when it comes to cardiovascular related problems. Comparing the different type of stem cells, for instance, blood stem cells, when it comes to cardiovascular problems, we have not really seen, or we have not had any significant results. We have not seen significant changes in patients with cardiovascular related problems, and even if you are looking at the researches that have been conducted, there is very limited data available on how blood stem cells can affect or improve patients with cardiovascular related problems. Now, once again, because these are autologous, blood as well as fat, they are autologous stem cells, and it has to be taken from the donor and given back to the donor. Therefore, the chances of us getting cells that can be used to correct these problems are very, very low, because most people who develop cardiovascular problems are usually older, and when we are using stem cells from a person who is 50 or 60 years old, it doesn't really make sense. But when we use mesenchymal umbilical or Wharton Jelly stem cells, we are using, once again, very young stem cells, which will definitely bring better results when it comes to regeneration and repair of like heart tissue or regulation of blood circulation. So definitely the results will be much better. So data regarding mesenchymal umbilical stem cells when it comes to cardiovascular problems is available, it's out there. Certain countries have even gone to the extent of performing open heart surgeries using umbilical stem cells. So we have, I think, enough evidence to show that it works very well for cardiovascular problems. When it comes to the personal experience that I've had, okay, I've got a patient from Indonesia. She was seen by me about a year ago. This patient came in with high blood pressure. My main complaint was basically high blood pressure, and her job is very stressful. So she was on 3 different types of high blood pressure medication when she came in. And as we all know, prolonged usage of medication has its effects on the body. Because of her age, she was only 40 something, she was in her 40s. She wanted an alternative where she would be able to have better pressure regulation without depending on so much of medication. We administered mesenchymal umbilical stem cells for her. She was given 2 sessions, and thankfully enough, her blood pressure reduced significantly to the point where she was able to stop. Out of the 3 medications that she was taking, she was able to stop 2 of them. And the 3rd medicine that she was taking, she has reduced it by half, and her pressure is amazing. It's picture perfect. It's at 120/80, and she's doing very well. At the same time, she has also noticed changes in her energy. She can perform better. Her mental capacity, the ability for her to focus improved, her memory improved, and her complexion also improved significantly. These are all just via 2 sessions of intravenous umbilical cord stem cells.